You say you work with a lot of people that were told they don't have enough bone for dental implants.
All the time.
And you work with them.
Constantly. And here's why. Because now we know, now we're comfortable, now there's science and research behind the fact that we can angle implants to take advantage of the bone that patients haven't lost. Typically, it's the front of your upper and lower jaws. So by angling the implants and putting the implants in native bone, not grafted bone, we have very high success rate, and we can minimize it to one surgical procedure. So many times patients come to me and they say, Dr. Moss, I was told by 2 or 3 different dentists that I am not an implant candidate, I simply don't have enough bone, and I'll say, that may be true in their office based on their level of education, their experience. Not that they're a bad dentist, that's just what they know. But we know a little more. We have a little more sophisticated technology, and thanks to 3D imaging and more advances in our field, has made this possible. We now can virtually plan on the computer before I even pick up a scalpel or place an implant in you. I've got it planned on your 3D model in the computer, so I know exactly where these implants are gonna go, how your teeth are gonna fit on them. It's really been a revolution in implant dentistry.
So but if you've been wearing a denture for like 30 years, is it true? Your bone dissolves?
Yes.
You could still do it?
Yes. Your bone dissolves because all of the bones in our bodies are shaped by forces put on them. Every pull of a tendon, even gravity, is helping keep your bone dense, okay? As soon as there's no more root stimulating the bone shrinks away. Now, implants replace the roots, so they help to stimulate the bone or load the bone, we say, put pressure on the bone and give it a reason to stick around. So implants not only can help you retain teeth, look better, feel better, but they also help you to maintain full bone volume. You've seen a denture wearer that's elderly, they take the dentures out and their face collapses. Why? Because they've lost so much bone structure. It's called atrophy. And with the teeth out, they got nothing to stop their jaws from closing. Their lower third of the face almost disappears. But bone loss of what used to be a problem decades ago is no longer an issue anymore, thanks to this all-on-4 procedure. In fact, I had one gentleman, as I was finishing up his case, I said, George, how long has it been since you've had fixed teeth in your mouth? How long have you been wearing these dentures? Randy, I thought he said 15 years. He grabbed my scrub top, pulled me closer and said, Doc, 50 years. 50 years, 5-0. He was wearing upper and lower dentures. So it's a little unheard of, but this gentleman in the Army at 27 had all his teeth removed. Gave him upper and lower dentures. Now he's 77, heard about us, said, let me check it out. I said we could do it. He had it done, upper and lowers, new lease on life.
Have you ever had to turn anybody away because you say you don't have enough bone? Is there always something you can do?
Honestly,
bone
Randy, I have had to turn some people away. Usually it's for medical reasons, right?
Okay.
They're on drugs that preclude them from healing very well, or their diabetes is uncontrolled. But now with these special implants that can go higher up into your cheekbones, the upper jaw, almost nobody's turned away. The upper jaw used to be the problem for us oral surgeons because it's a little softer and it wasn't much. Now the lower jaw is more of an issue sometimes, but about 98% of the patients that come see us can have this procedure done, yes.